Governor, thank you very much for taking the time to talk to me. Before we get really going into the entire issues, I was able to get some pictures of your new baby. How is fatherhood treating you these few months in?
Well, I'll tell you what, before Mamie was born, we have two others, and my wife was deputized by the Gadsden County Sheriff, and that's good for a year, and she has used that to keep law and order around our house because our 3-year-old's running around, our 2-year-old. Mamie's 4 months. She is very happy, great baby, but we've basically, as a family, been at the mansion since the pandemic started, and so I'd like to, when we settles down, to be able to get the kids out and be able to do some stuff.
Does she get nervous when you are traveling around the state at all, when you come home at night?
No. It's all good. We've talked about it. We were so busy in January, February. We think to ourselves, we may have even had this thing, when it was going around with that. But no, it's all good. And, she's doing a great job because it's very difficult circumstances. And so, I'm living proof of, what these spouses have done with having to do the schooling. Now, our kids aren't school age, but you go back from mid-March and people's worlds have been turned upside down. And, we see that to a certain extent in our household. And I know many Floridians have had to deal with that as well.
Well, we'll talk more about that, but let's get an assessment. Last week was the deadliest week that the state of Florida had. I think 4 of the days last week they set records. We set records on the number of deaths. Where do you see things today?
Well, one, I think it was a rough week to have those reports. I would say, though, that when they're reporting, that's not that the fatalities necessarily occurred. They've been kind of occurring. We know when we started to see the surge of people going into the EDs, the hospitalizations increased. Then unfortunately, we were going to see some painful outcomes. Although I will say, if you look at the recovery rates, comparing Florida to some other places that have been hit, people are actually recovering too. And I think that story doesn't always get out there. You'll have people who will end up in intensive care where had they been in northern Italy 4 months ago, probably wouldn't have a chance. Those people are now walking out of the hospital. So I think our medical folks have done a phenomenal job. Obviously, every life counts and we mourn every death. But I really do believe that without their expertise, and then I think also Florida's done a good job of protecting the most vulnerable, we would have seen worse outcomes. And so the recoveries have improved over the last 4 months. But I think the general trajectory, when you look at kind of what the leading indicators are, to me, the number one indicator that I look at is how many people are showing up to the emergency department with COVID-like symptoms. Because these test results, it's a matter when the labs dump them on us. Sometimes these results are from 2 weeks ago. We just don't know. But those ED visits are really key because that's somebody that is going to the emergency department. We saw those increasing. So all of May, beginning of June, we were very flat on that, below where any indicators. Then we started to go up at the end of June, and then we peaked on the week of July 7th. Some counties peaked before that, some a little after, but basically right in there. We're down pretty significantly from that peak. And then I think you've also seen the hospital census with COVID-like illness patients. That has declined. Even in Miami-Dade, it's declined. The admissions have slowed. The discharges are increasing. So those are good trends. We obviously want that to continue.
Let's talk about some specifics, some of the criticisms that you face so you have a chance to address them. There's an overall impression, I think, that's been struck that you seem beholden to the Trump administration to follow policy along his line. The Washington Post referred to it recently as that you are tethered at every stage to the Trump administration. How do you respond?
First of all, that's just a phony narrative. They were trying to say some of the decisions I made had something to do. I had no contact on a lot of these decisions. So we're doing what's best for Florida. I will say that they've been a great ally for Florida. When we've needed help, so for example, some of the hospitals were running low on the remdesivir, which is a therapeutic, because we had a lot of hospital admissions a couple weeks ago. And there's a big bureaucratic process involved with that. I was able to pick up the phone, call the president, say, Mr. President, I know they're supposed to come a week from now. I need it in 3 days. And guess what? They showed up in 3 days, and we've been able to get support. So I think it's been a good relationship. But in terms of the policy decisions, those are decisions that we're making locally. And I would note, I've worked collaboratively with a lot of the local communities. So Southern Florida counties have approached it a little bit different. I've supported empowering them doing that, and then obviously other parts of the state may have a different view. So it's been very flexible. It's been bottom up. It's absolutely not been dictated by Washington. In fact, I would say if you listen to some of the stuff coming out of the White House, they've criticized me, some of these people like Kellyanne Conway or some of these other folks, and that's fine. So, but you got to do what's best for Florida, and that's what we've done. So a lot of that is just them trying to create a narrative, because it's all about, for some of those outlets, the election. This isn't about politics. This virus doesn't distinguish between Republican, Democrat. We're going to get through this.
Well, let me
and
ask
then we need to have Florida be able to recover in a way that minimizes some of the fallout from the protective measures.
Well, let me ask you this. You said that Kellyanne Conway criticized you. Where have you diverged from the administration?
Well, for example, the 30 days to when they extended the 30-day guidelines, my recommendations was that we didn't need to extend the 30 days because it was clear the reason we did the mitigation, remember, wasn't because we thought we could suppress the virus. We knew it was out. It was to slow the spread so that the hospitals wouldn't get overrun. It was my view that outside of New York City, our medical system was going to be able to handle what came down the pike. And sure enough, that happened in Florida. And so, my advice has not necessarily been taken. And then also in terms of when we went to phase one, they criticized us for doing phase one. But I can tell you, phase one in Florida, the 6 weeks after that were the lowest numbers that we had for coronavirus. If you look at COVID ED visits, if you look at positivity, hospital census. And so, that was really, I think, a good run for us. So they have criticized, but we're going to do what we got to do. And at the end of the day, the states have all gone in their own directions. There's not been any uniform way to do it, and certainly for them. And I give you an example. They had the White House task force said, you need to close daycares at the start of this. I didn't do that. I didn't see kids as being risk, fortunately, or low risk. And then I knew the essential workers, they had that. So we kept it open. Didn't have major problems with any of that. And then more recently, they were saying that we should close gymnasiums. The problem is that people who are staying in shape, that's one of the best things you can do to fight coronavirus. So we have diverged from recommendations, and basically I'm just trying to do what I think is best for Florida.
I want to give you a chance to respond to another thing that was recently in the press. The Sun Sentinel ran an editorial, "Help us out, Governor DeSantis, we're dying here," and they wrote, "Your daily upbeat message is at odds with what Floridians are going through." Do you think that you have tended to try to find positive elements at the risk of sounding out of touch?
Absolutely not. First of all, everything that's presented typically is presented negative. So there's a lot of negative that people have. And I've always said that this is...
But from you?
Well, right. So I've always said it. I've always talked about this being a serious challenge. When we saw the increases in hospitalizations, we surged personnel down. We're getting remdesivir. We're always responsive to what's going on. And we understand what families are going through. For example, some of the protective measures we've done with nursing homes. That has saved lives because we've kept virus from spreading more than it would have. But we haven't had visitation for these folks since the middle of March. That is a huge human cost to families who just would like to be able to have that human contact. So I understand how difficult the situation is, but I think there's also the question, do you want to be in a defeatist posture, or do you want to be in a posture that say, you know what, we're Americans, we can handle this, we've handled difficult things before, we are going to get through this, and we shouldn't let fear overcome our sense of purpose. So it's a serious issue. But I just think that for me to always say the sky is going to fall, rather than tell people, yes, there is a light at the end of the tunnel. Hang in there. Keep doing what you're doing. A lot of people have worked very hard over the months. Social distancing, hygiene, face masks, the elderly doing a lot to isolate themselves from risk. That's not easy to do.
I want to move on to a couple of other things, but I want to stay with nursing homes, and I do agree with you. I think that the actions that Florida took will be studied, as one of the better examples across the country in terms of how this pandemic was handled. I think you made certain decisions that other states didn't, and I think we did not see the types of deaths that many had anticipated in our nursing homes. Are you thinking, though, of lifting that ban? You talk about the human toll, the suffering. Where are you at, and under what conditions will you open the nursing homes to visitation again?
So I've heard from so many families about it. We were looking to do this, and we were working on it in early June. obviously, you know, our prevalence started to go up towards the end of June. I was not comfortable pulling the trigger. So I think we're going to do two things. One is the federal government is sending point-of-care tests to a number of nursing homes. It's not going to be every nursing home, but I think anyone that has that point-of-care test, if you test and it's a 15-minute deal, then I think the family should be able to go in. But then the question is going to be beyond that, because there's not going to be in every facility, you know, when do we then do that? And I think the prevalence has to be lower in the community. We're now testing the staff every 2 weeks. Every staff member gets tested. There's over 200,000 people working there. The positivity has been lower than the general public, but we still have, even at a 3% positivity, you're talking about thousands of folks. So we want to make sure we can do it safely. I think if our trends continue to go down, if the positivity goes down, you know, we definitely want to look at it. But it is something that has to be addressed because...
Well, are you thinking in a matter of weeks?
Well, I hope, you know, look, our prevalence is going down. I mean, today's numbers are the lowest we've had, I think, probably since June. If you look at the case numbers, the positivity is going down. South Florida, I think, is starting to go in a good direction on that. So it's going to have to just be a kind of a, you're going to have to look at the data. I'm going to look at the COVID-like illness visits, but we've got to do something. This indefinite isolation has huge costs. I'll tell you a story about there's a lady up in Northeast Florida whose husband was at a memory care center. She wasn't allowed to visit him, so she decided to get a job with the memory care center, and so now she's able to go in to visit him. So that's the type of, I think, lengths people are wanting to go to be able to have contact with their loved ones, and it's something that weighs on me every single day.
I know that last week you gave a speech where you started talking a little bit about more of the human toll. It tended to be more of a shift than we've heard from you before. I think that the one thing that I've heard from talking to people around you is that you have always been someone who immerses yourself in the data. You look at the numbers, you dig deeply into the statistics, and that sometimes when you're regurgitating those and using those, you can come across a little bit cold. It's just the nature of numbers. Thursday, you started talking about a Korean War veteran just the same thing that you sort of talked about, how we can get through this together. Was there a conscious decision on your part to start changing the way your messaging on this issue is?
Well, I think it's like, you know, the data, I think just people get numb to it after a while. And I think people appreciate the fact that I really study this, and I can tell you, you know, a trend in Manatee County versus Brevard County, and you want the governor to be able to do that.
But you don't want the governor to cherry pick statistics that make him look good only.
No, of course not. Well, but first of all, it's not about me looking good. It's about getting the state going. But you know what? The numbers on a page, this is about individuals' lives and livelihoods. And obviously we've had over 7,000 people die with corona-related illness. We've had 28,000 people hospitalized. Now, fortunately, most recovered. And then we've had obviously others who've been infected. But we've also had 10, 15, 20 million people who haven't had necessarily impacts from that, but their lives have been affected. And I think that we just have to remember all these measures, all the changes in society have had such a profound effect. That's one of the reasons I've been working to try to get kids access to schools. I understand some parents may not want to have kids in class, but many do. And my fear is you know, to keep kids out indefinitely, that's going to have huge ramifications. And so it really is more about it's not about positivity rate this. Yeah, we got to monitor that. But it really is about the human stories that have emerged from this.
A cynic might say that your change of tone matches the fact that your poll numbers have dropped.
I've not taken a poll since I've been governor, believe it or not. So I didn't care about them when they're there. As a leader, you've got to lead. And particularly at a time when there's a lot of fear and apprehension, obviously it's being driven in certain directions. There's a lot of partisanship. You know, my view is to be kind of steady. You know, you want to have a steady rudder. You got to have that ship sailing. Sometimes it's stormy, but I got to keep us on course. And so sometimes that means, you know, you'll do things that, or you'll be in a situation where, you know, well, you'll get dumped on. But I think at the end of the day, how we get through this and then how we emerge on the other side in terms of all the other lives that have been affected, you know, through economic, social isolation, all that, that is really going to be the determinant.
Well, let's talk about that moment that has stood out that you've been dumped on for, which is that press availability you had with the vice president on May 20th. that where you said we've succeeded and people don't want to recognize it because it challenges their narrative, it challenges their assumption, so they got to try and find a boogeyman, maybe black helicopters circling the Department of Health.
Well, you remember, though, what that was in relation to. The numbers in May were very low. And so the narrative in some points was that Florida was hiding numbers or falsifying. And it was a conspiracy theory. So it frustrated me because they're dumping on our Department of Health. These people have been working hard. It's not an easy job. I'd also say that, you know, flattening the curve was not meaning we were never going to have any infections. I mean, it was really to make sure the health system was able to handle the patient load, that we didn't want to get overwhelmed. Clearly, we were able to get through the March-April period doing that. That bought us time. All the hospitals now have PPE. We have therapeutics like remdesivir. We have big-time testing capability, and then we've established 20 COVID-only nursing facilities. So we took the time where you have flattening the curve to prepare, and so as we've now faced this Sunbelt wave, we are so much better prepared. We were able to handle it much better than if this type of wave would have hit us in March or April. So that's really what the initial kind of phase one flatten the curve was all about.
But when you watch that, or when you see your words repeated back, do you admit probably wasn't your best moment, and probably let your frustration and anger get to you a little bit?
Well, here's the thing. I mean, you know, I would say this. I don't mind people dumping on me. That goes with the territory. One of the things that has frustrated me, though, is, you know, there's ways to present things that have context and perspective, and then there's ways to present things that cause people to get really, really scared and frightened. And I think there's been a lot of the latter. I don't think that there's been as much of the former. And so my frustration has been, you know, people, man, some of these channels you watch, you just want to go hide in the closet because it's so doom and gloom. So I just wish some of this stuff had a little bit more context, a little bit more perspective, because I think folks would be able to, you know, to have a good handle on some of this.
You said before that the numbers on May 20th were good, and in fact, you're right. There were only 527 new cases on that day, and at the time, the state had a total number of cases of 47,000. The total number of deaths was just over 2,000. Since you said that basically we had succeeded, an additional 450,000 people have now tested positive, and more than 5,000 people have died. What happened?
So we got through the first phase. That was the whole point of the flatten the curve. I never said that we were not going to have to deal with the virus. It wasn't going away. Now, we didn't know when we would have to face any type of surge, but we saw it just like all the other states in our region saw it towards the end of June. But you know what? We were prepared for it. You know, we had the systems in place. We had the resources in place. It's not been easy. Part of it is the testing. I mean, if you look at the amount of testing that's been done, it's pretty frequent. Well, we'll have 100,000 test results in a single day. We're obviously identifying a lot of asymptomatic cases. Well, you know, I looked at Japan, and they're seeing a, quote, upsurge. They do about 20,000 tests a day. Tokyo is bigger than the whole state of Florida. We're doing 100,000. So part of the reason we've had a lot of cases, there's been an increase in prevalence, of course, but then also we've broadened the ability to test really throughout the community regardless of symptoms.
Do you think we're doing too much testing?
Well, I think that we should really focus on better turnaround times with the labs for the folks who are symptomatic or in the at-risk groups. What's happening with the asymptomatic is if you test somebody, I can't tell you whether you have live virus because you can test positive. The CDC says you can test positive for 12 weeks now. So when someone comes that's asymptomatic, it takes them a week to get the test results. They're not infectious most likely at that point, even if they were infected. So the PCR test just has limitations when you're dealing with asymptomatic people. We obviously thought that the more that we would test, we could isolate. But the labs got so backed up that in point of fact, it just didn't work that way.
And I want to come back to that in a second, but I want to just stay with the idea of the message that you sent on May 20th and whether or not your positive message that we've succeeded in basically gave people the impression that the battle was over, we had won, and that people could go about their lives again, which then also caused the resurgence to happen.
But that's okay, you know, that's one little clip. But then what about all the actions we were taking during that time? I mean, if I thought it was over, I wouldn't have set up all the COVID-only nursing facilities. I wouldn't have done all these new test sites. I wouldn't have sent, you know, more PPE to the nursing homes. So we continue to act and continue to prepare for the virus to resurge. And I think if you look at that time period, I mean, even all the way and through mid-June, we were doing pretty good with the COVID-only illnesses. So if it was somehow May 20th, everyone started going haywire, I mean, it's a 5-day incubation period, we would have seen it. But I do think that throughout that whole March, April period, people were trying to say that Florida didn't flatten the curve or whatever. We got through that initial hump and were able to make the preparations. And so I think those preparations were the right thing to do. But if I thought it was over, I wouldn't have taken any of those actions, to better prepare ourselves.
But did you communicate that, do you think? Do you think that you stood at a podium, you made it clear to the public? I'll grant you the actions you took suggested that you were waiting for and were getting prepared for a possible spike. But do you think that the way you've communicated that to the public, what you've spoken, has given them the impression that they need to stay diligent? And one issue that keeps coming up is the idea of a mandate about masks. But even if you don't want to mandate masks, couldn't you be doing more to basically tell people, I don't want to have to mandate it, but everyone in the state of Florida should be wearing a mask?
Well, we've supported all that. I mean, I think we've always from the beginning, well, not from the beginning because the masks were out of favor initially. But when we got to late April, we said the things you Floridians have to do: protect the elderly, hand sanitize and make sure you're doing that. Physically distance, avoid closed spaces, crowded places, close contact, and then wear a mask, particularly when you can't physically distance. One goal, one Florida, we're continuing to reiterate. It's important. Yeah, I don't think it should be, people should get fined or imprisoned if they don't do any of these things, but we're appealing to people to do the right thing. And I think most Floridians have done that in various jurisdictions, and so that's very important. Always, always, always stressed looking out for the vulnerable, in particular when you're talking about physical distancing. We never let up on that message because we knew that this was not something that you could just simply wish away.
Do you think that you could have done more in terms of communicating the idea that everyone in Florida should be wearing a mask? I don't want to have to mandate it, but everyone must start wearing masks.
Well, we have communicated. I mean, when I put it out there when we first added it to our guidelines, no one was talking about it at the time. It was almost like, I don't even know if it made any news because it wasn't political yet. And so we do want everyone to do that, particularly in close contact. But I also think it's important to just be honest with people. The mask, there's a lot of disagreement in the scientific literature about how much protection that gives you. So I just don't want people to think that you do the mask to the exclusion of all the other stuff. And I'd hate for someone to be with an elderly parent or grandparent thinking that the mask is 100% protection. I think it may stop some of the droplets, but it's not going to be 100%. I wouldn't want people to put themselves in jeopardy. So the mask is part of a larger, I think, set of priorities, but it shouldn't be done to the exclusion of the other priorities. And I think once this became political, people were just saying mask, 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 and really weren't talking about a lot of the other stuff. So ours has been a more balanced, I think, message. I think it's a message that's more in tune with understanding the benefits, but also understanding, that all these things, have limitations.
Why do you think it became political? I mean, on both the right and the left. It's on the right, it seemed to become an issue of my freedom, you can't tell me what to do, I have special liberty, I'm an American. And on the left, it became an issue of, from their perspective, public health concerns and the scientific community saying, if you wear masks, the amount of suffering will go down.
Well, I think a couple things. One, we're just polarized right now. It's a divided country, unfortunately, an election year. So I think that colors all this. Some of these European countries have not had the same, I think, reactions. Most of them aren't doing masks, but it's not a political thing. They just make the judgment, in terms of science about it. So I think that's part of it. But then I think part of it was, I remember when some of the leading lights in the administration were telling people, don't wear the mask. And so people were doing the mask and they're told not to. Then all of a sudden it changed.
Wait a second, that was very early on. That was Dr. Fauci, I think, is one of the ones who said that. And that was more because of a supply issue in the very early days.
That wasn't how it was communicated. They were basically saying the masks don't work. And now they say, well, it was because we didn't want you taking the N95 mask, which was a legitimate thing. But I think the messaging should have just been, look, we think some of these masks could be helpful for the general public, but let's let the healthcare workers make sure they have it. And then as we get more supplies, then if you wanted to do it, do it. But that really wasn't how it was portrayed. So I think people, there's just been mixed messages. But for me, I didn't have any political considerations. I looked at the literature. It's very mixed. You got to be honest with that, and there's a reason why a lot of these other countries have not done it. But my view was, look, if it can stop 25% of the droplets and you're in a close contact situation, that can reduce transmission, and we should want people to do all they can to do it. And I also thought, because we were kind of coming out of the trauma of the March and April time when people were scared, I was like, look, maybe it's going to instill some confidence in folks, just to see that their fellow Floridians, are taking it seriously.
I do want to cover unemployment. I want to get to schools, but I just want to stay with the response to the virus for a second. The question of reopening. It seems to me that critical to the plan to reopen was having testing in place and contact tracing. Those were two key elements of it. Testing became a nightmare because we couldn't get the results turned around, and contact tracing in South Florida has been dismal. How can you have reopenings if you don't have those two things, if you don't have quick turnaround on testing and you don't have adequate contact tracing?
Well, initially when we started phase 1 in May, the turnaround was better because nationally we were probably doing 400,000 tests. Well, now we're at 900,000 tests a day. So part of that, I think, could not have been foreseen, that the labs would get worse as things went on, but it's just because of the huge volume. Now, contact tracing, I've always said there's a role for it, but it is not going to be all-encompassing when you have an illness that's largely asymptomatic. I mean, most of the people who have this or who have had it either have mild or no symptoms. And so in that respect, this thing's prevalent, we know it's there, so the contact tracing is more targeted. If you have, like we had agriculture sites where we were contact tracing, nursing homes doing that, and we've actually had some success there. But writ large, it's going to be very difficult to do contact tracing if I can't tell you in a PCR test whether an asymptomatic carrier actually has live virus. And we now know you can't do that. I think at the beginning, we tended to think if you test positive, you have live virus. Well, now we've seen people that'll test positive 30 days, and CDC says up to 12 weeks. So that makes the contact tracing of asymptomatic very difficult. Even if you got an immediate turnaround, it would still be somewhat difficult, but a 7-day turnaround just makes it very difficult.
That's the second time you've cited this CDC study that talks about live virus or dead virus remaining in the system for 12 weeks. I talked to a number of epidemiologists and folks who study infectious diseases, and that is not clear to them. It's a very difficult virus to grow, so being able to do the test.
That was what they put out in terms of the employer stuff. And it wasn't that everyone has it for 12 weeks. They say it can survive dead virus up to 12.
I guess what I want to ask you is, so with that study in your mind, do you foresee, for instance, saying that it's okay for a person who has a positive test to go back to work if it's been a week or 2 or 3 weeks since their positive test?
Well, that's what CDC's guidance is.
But is that what is your guidance going to be?
No, exactly. So we're going to follow their guidance. So basically, it's a symptom-based approach. So if you test positive, you obviously isolate. But then if you have had a certain number of days, I think it's between 10 and 14, depending on the circumstances, with no symptoms, or the symptoms have subsided, no fever, then there's a pathway for you to go back. Because
this is going to be a new policy that you're going to be implementing.
Well, this is the guidance we're going to give to employers. I mean, we're not obviously requiring, we've never necessarily required a negative test except for nursing home situations and a few others. Most of the employers, though, have been doing the negative PCR test. And I think CDC's guidance is we should focus more on a symptom-based approach rather than a test-based approach. And I think that's probably the better way to go. So yeah, we're going to follow that. I think the Department of Health is putting out some guidance on that today. It's not necessarily mandatory, but I think most employers will look at that and probably feel that's a little bit more flexible.
Do you run the risk of confusing people who may say to themselves, I tested positive for the virus, but does my positive test really mean anything? You see what I'm saying? In other words,
but at the same time, I mean, as we get new information, I think we have to be honest about what that data is telling us. So, for example, if we were sitting here in the beginning of March, I mean, I would have thought a positive test was like, man, you're definitely, and then just we've learned more about kind of the limits of the PCR testing. I think for sure, if you are experiencing coronavirus symptoms and you test positive, you have live virus. I think if you have no symptoms, there is a question about whether we can tell you definitively whether you have live virus based on this.
I want to talk about schools for a second now. On July 6, Secretary of Education Richard Corcoran issued an executive order where he talked about you know, wanting people to go back into brick and mortar schools in the fall. There was some immediate pushback from a number of school districts on it. On July 21st, you said, in response to it in a press conference in Orlando, well, first of all, I didn't give any executive order. And you went on to say they have a board, they do things differently. I just want to be clear. Before Secretary Corcoran issued that executive order, did he talk to you about it? Did he clear it with you and your people?
We knew we wanted to obviously have people have an option to get the kids back in brick and mortar. How he did that was formulated within his department. I think what he would say is, and I think in response to some of the criticism, had he not done that, and then a school opted against having in person, they would have lost a lot of funding. And so he's providing a pathway actually for more flexibility so that they can maintain the current funding.
But I want to be clear, did you know about it in advance of his issuing the order?
I knew that we were going to offer in-person instruction. That was something that they did at the department in terms of their policies.
Do you disagree with his order?
Well, the way it was framed, it wasn't consistent with what I believed. I think if you actually read the fine print, though, it was not necessarily the way it was portrayed. You know, my view is Florida parents should have a choice. If you're not comfortable sending your kid to in-person, you should be able to opt for virtual. But if you need in-person, we got to find a way to make that happen. And all the districts may be on different timetables because I understand there's different local conditions, but that has got to be the goal. And I also don't want to see them lose a lot of funding because under statute, you know, you got to offer a certain number of days, and if you don't do that, the funding goes down. The legislature's not coming in to clean that up anytime soon, so that's the reality.
I just want to be clear and just see if we can say it as clearly as possible. Miami-Dade, Broward, Monroe County, a number of other districts have said they are not opening brick and mortar schools as they normally would at the end of August, that they will begin with online virtual classes, and that they will reevaluate during the course of the semester, but they're making no guarantees of having brick and mortar open this year. Are you okay with what you have heard from those districts right now?
Well, look, the idea that we wouldn't have any brick and mortar for the rest of the year, that's not going to...
Well, doesn't the virus dictate it?
The virus does dictate it, but we should also be mindful of the trends. I mean, I think that you wouldn't want to make the decision in the middle of July when we were at our apex. So you're looking now. I think we may see some good trends. My view would be, look, be flexible. Don't get dug into not having in-person infinitum. Obviously respond to local conditions. But one of my big concerns, and we highlighted this the other day in the Tampa Bay and Clearwater, special needs students. The virtual doesn't work for special needs students. We've got to have an option for them at a minimum to have in-person instruction. I hope all districts, you know, will try to get that done as soon as possible.
But what Miami-Dade, Broward, Monroe, and I'm not sure Palm Beach, but what the South Florida school districts have essentially said is they will evaluate, and they've given dates where they'll look at it again, you know, at sometime in September and decide there. I just want to be clear. Are you in conflict at all with what the local school districts in South Florida have done so far?
I think we want to work with them. We understand their unique situations. I would just make sure that as long as the goal is to give the parents the choice and they're going to work to get that done as soon as they can, you know, I don't have any rigid timetable for it because I understand their circumstances on the ground.
All right, let's turn to unemployment. You know, I guess the first question I want to ask, obviously, so Congress is, the $600 additional supplemental payment is no longer in effect. Congress is working on it. Would you encourage Congress to pass reinstatement of that $600 a week check?
You know, what I would have them do is, because some of the employers will say the employees have come to them and said, look, I want to come back, but you know, I would make less as a result of that. And I don't blame someone for doing that. I mean, why would you? I mean, that's an incentive. So maybe take the same amount of money and just convert it into a reemployment bonus. And so as people go back to work, they get the same amount of money that they would have gotten, but you don't have the disincentive. So if that's the problem, you know, I think that there's ways you could do it. I know some people have talked about doing that.
But there aren't enough jobs for everyone who wants to go back to work right now. The state's unemployment rate is high. The number of available jobs isn't there because a number of businesses have not been able to reopen.
Yes and no. I mean, I think that, well, first of all, in Florida, all businesses are open except for nightclubs and pubs. Everything else is operating. Now, maybe some businesses, obviously it's a tough environment, I get it, but there's a lot of businesses. We have homes are being sold in Florida. We've got some good indicators going on. There are needs for some jobs to do it. So look, what I would say, it's a tough time. We need to be there for people who through no fault of their own, have faced tough times. But if you can do it in a way that helps those people, but then also helps the re-entry into the workforce, if it could be structured that way, I think that would be a win-win.
So you oppose continuing of direct payments?
I didn't say I oppose it, but I say, structure it in a way so you can have the same exact amount of money, but structure it in a way that will provide an incentive to go back. And then if there's no jobs, then the person's in the same spot and they're still getting the money.
They're still getting the $600?
Yeah.
Okay, because right now, I guess one of the things that this pandemic has sort of shown is just how poor Florida's unemployment system is. I'm not even talking about the website, just the fact that our maximum benefit is $275 a week for 12 weeks. I know that's based on a metric that looks at the fact that the state had low unemployment, so therefore all those trends and numbers are down. Part of it was also having to do with wanting to entice businesses to come to the state, so lowering the amount of money that they would have to pay into the unemployment system. But as we look at it now, $275 for 12 weeks, nobody can live on that. Do you have friends, cousins, anyone who has lost their job and spoken to you about that and the notion of trying to survive on $275 a week?
Yeah, and I think that, well, I don't have cousins, but you have people throughout Florida that I've spoken to who were just working hard, not following the rules, and through no fault of their own, they didn't do anything wrong at their job. The economy stopped. We've never had a voluntary secession of the economy in history. We had how much did GDP go down in the second quarter?
So should Florida be doing more for those people? Can you, by executive order, increase the amount of money, the $275, which is a maximum?
So here's what we're doing, though. No, I get it, but here's how we're approaching it. So I took the CARES Act money we got. The first big disbursement I did was really a record $250 million for affordable housing, rental assistance, mortgage assistance, so people are able to stay in their homes. Now, we obviously suspended evictions and foreclosures through, I think, the beginning of September. But putting that money there, those are exactly the types of people we're trying to help. Also, I've resisted calls to shut down the state because I think having society function puts us in a better posture to handle the pandemic. But I'm also mindful of the second order effects of this. So we've been able to, our unemployment rate is high, but it's lower than what people thought it was going to be, 10.7%. Businesses are operating. The more we can get that going, particularly as we get on the other side of this hump, hopefully, then we're going to be able to put more people back to work. So part of it is the unemployment, I get that, but part of it is some of these other things that we've done, and that $250 million for the affordable housing, that's going to be a huge shot in the arm for a lot of low-income families.
But let's stick with the $275. Do you think that number should be raised?
I would look at it. I don't think I can unilaterally do it. I think we would have to have the legislature come in and be able to.
Why not call a special session to examine it? People are right now only going to get at most $275, regardless of what.
Well, first of all, there will definitely be more federal assistance. Even apart from the unemployment, I can tell you there's going to be another $1,200 most likely that's going to go out to folks, and there is going to be some form of a federal unemployment supplement. So I'm going to look to see what happens with that. Look, if we need to act in Florida, I'll be happy to do it. But at the end of the day, there is going to be a phase 4 package from the federal government. I'm not in the Congress anymore, thankfully, but I know that something's going to come down the pike.
I want to be clear. The website, the unemployment system website, was not under your administration. It was under previous administrations. In fact, as I understand it, this website, which has proven dismal, I think you referred to it as jalopy, cost the state $77 million, with $56 million going to Deloitte. Should the state be looking to file a lawsuit to try to get some of that money back?
So the Inspector General, I had her invest, so that's underway. We're going to take a look at that and then figure out what we have to do. Now, the system was obviously problematic, but I would also say if you and I decided, hey, let's just do a new unemployment system, like say 6 months ago, you wouldn't have envisioned the economy just stopping. Normally a recession, it kind of evolves, the unemployment goes up, you're able to staff up as need be. I mean, we were in a situation where just from personnel, we had more personnel than we needed in February because our unemployment rate was 3%. And so you had to beef it up and do all that. So there was a lot that was done to fortify and re-engineer the system. I also brought like 2,000 state employees from other agencies to do all hands on deck approach. And I think now we've paid out close to $13 billion since then. But man, from the end of fourth week of March through most of April, we were in really dire straits with that system. So I do think we should get the results of the IG, and then if there needs to be some type of suit or some type of accountability, we absolutely need to do it. I mean, my thing is like a lot of these unemployment systems throughout the country, weren't very good, but a lot of them were like 40, 50 years old. Ours wasn't really old. I mean, ours was really 5, 6 years ago, and it should have been done better for that price tag to produce better results.
It was set up, as I understand it, to handle no more than 1,000 claims at a time.
2,500 surge capacity.
Right? You don't build a system like that for good times. You build it for cataclysmic times. You build it for worst case scenario. Do you believe that the system was in part put together the way it was to discourage people from being able to collect
unemployment? I think that was the animating philosophy. I mean, having studied how it was internally constructed, I think the goal was, for whoever designed it, was let's put as many kind of pointless roadblocks along the way so people just say, oh, the hell with it, I'm not going to do that. And, for me, let's decide on what the benefit is and let's get it out as efficiently as possible. We shouldn't necessarily do these roadblocks to do it. So we have cleared a lot of those, and I waived a lot of requirements through executive order. But I think going forward, I want all our systems, including unemployment, to be user friendly, and it was not user friendly.
Well, that system was designed and implemented during the Rick Scott administration. Do you think that was Rick Scott's intention, was to discourage people from applying for benefits?
I'm not sure if it was his, but I think definitely in terms of how it was internally constructed, it was definitely done in a way to lead to the least number of claims being paid out.
Now, there was an audit that came out in 2019, I believe, that pointed out many of the flaws. Should you be held responsible for not having acted on that audit and corrected this system?
Well, so that was an audit that was given to the agency head. Nothing ever reached my desk. I was not asked to do anything. I wasn't asked to seek more funding from the legislature. If I was, I probably would have done it. But I looked at that audit, and honestly, that does not answer really the systemic flaws that was evinced with this thing. And so even if those things were done, and they should have been done by the agency, we still would have had the same problems.
You mentioned evictions before. I just want to ask, you have suspended evictions month to month. As you said, I think right now you're through basically the September 1st. Under what conditions will you stop this? Because obviously I know there's a concern among folks who own properties. They're losing out on money as well. And once the moratorium on evictions is lifted, do you have a plan to deal with the potential of having large numbers of people starting to enter the process of being evicted?
Well, that's part of the reason we thought that doing $250 million from CARES Act for affordable housing was so important. So that'll be going down to these local agencies. They'll be able to give rental assistance. They'll be able to give assistance to be able to keep people in their apartments, keep people in their homes. And so, yes, that's one of the reasons why we did that was because we understood. We also, what we did in the most recent extension was say, look, if you've been negatively affected by Corona in any way, job, personal, medical, then obviously you do. But it's not for somebody who's just been working to say, you don't have to pay rent anymore. So we made that clear, and I think that was a little bit more targeted and should be helpful.
I want to move on to elections, but before I do, there's a view that Surgeon General Rifki's is somehow in the witness protection program. We don't see him very often.
He's worked very hard. I mean, it's not true. The guy he's worked 7 days a week since probably the beginning of February, because we were monitoring this in January. We started testing throughout February. It's interesting in those days. I mean, there was like 10 counties that had a case before Miami-Dade did, and so he's been working incredibly hard.
Why don't we hear from him? I mean, he's the state's top health official. Why don't we hear from him during a health crisis?
Well, you do hear from him. I mean, he's put out health advisories. He's reiterated different guidance. We put out more recently.
We don't get a chance to ask him questions, interact with him. Should we be seeing more of him?
Well, look, I mean, I'm sure if you wanted to talk to him, we could arrange that to happen. I mean, quite frankly, I think the Department of Health has been treated very unfairly by some outlets, and I think that's kind of caused, him to look at the press and just be like, look, we want a fair shake. But I know you'd give it to him, and so, we'd be happy to arrange that.
Philosophically, you weren't the first. I mean, he's a pediatrician by training, and everyone I've talked to, by the way, about Dr. Rifke says he's very hardworking. This is not somebody who shirks any responsibility on his side. But public health and infectious diseases and this sort of area, epidemiology, is not his calling area. And governors for years for administrations have appointed different people into the position of Surgeon General. Going forward, not as a criticism of Dr. Rifke, but going forward, do you think that we should be thinking of the position of Surgeon General slightly differently because of incidents like this, to where we should have someone who is an expert in public health policy leading that position?
Well, I'll tell you, I think you deal with candidates as they come. I would not put that requirement. I think there's a lot of great physicians out there. I'll tell you, the folks that I've dealt with that have been the most insightful have just been physicians that are actually working in these hospitals. We have some great chief medical officers throughout the state of Florida. Not all of them are epidemiologists, but they really have a beat on what's going on. So I don't think that there's any one formula, but I think you need someone that's got a great track record, that's very smart, and that's willing to work hard, and he's worked really hard.
And I don't doubt that. I want to move to elections, but I just want to ask about the vaccine potential. We're all optimistic or hopeful that we're going to have a vaccine sooner than later, possibly by the end of the year. The federal government has tended to rely on states to handle issues related to the coronavirus. Do you believe that the state should be responsible for how it distributes and works with getting the vaccine out to its population?
No. I think that's going to have to be a federal responsibility. I mean, to do it to the states, that's just adding an extra hump. Look, we've got to see how this works out. I know that there's a lot of people that are optimistic. I mean, my view is just, look, the flu vaccine is only certain effective, so we just have to let it go out. I mean, to me, the $1 million question is how effective it's going to be. How effective will it be for our elderly population? Flu vaccine is not as effective with the elderly as it is with other age groups. If it's effective for the elderly, that'll be 100% game changer. If it's not, then obviously we're still going to have to be in the fight at the nursing homes, messaging the social distancing for our elderly population.
My guess is the states may end up having some responsibility here. Do you have in your mind an idea of how, obviously, the elderly, the most vulnerable population there, I think most people would agree, are probably first that would need to be able to get the vaccine. But have you given any thought to, for instance, more vulnerable populations? Should preference be given to African American, Hispanic communities, farm workers, for instance, and those sorts of things, as opposed to folks who may otherwise be healthy? Have you given any thought at all to the issue of the vaccine and how it should be distributed?
So certainly, elderly should be first in line, without question. And then other people who have some of the key medical conditions should be first in line. And I think that's regardless of community, and that should be the case. So people have asked me like, oh, are you going to get like the vaccine first? No, I'm gonna defer. Those folks should be first in line, not me. And so that's really where we're going to focus. I also think what we need to do is get a better handle on the seroprevalence in different communities throughout our state. We've seen the seroprevalence increase. I think that's part of the reason you're seeing the cases go down and some of the ED visits go down, because that builds up immunity in the population. So we need to look to see which communities have the highest seroprevalence. And obviously, we don't know how long the immunity is going to last. I think most people say at least 6 months. But that, obviously, we're going to get more information on that, because there's people that were infected in January. Now, we haven't had any documentation of a reinfection yet anywhere in the world. If nobody gets reinfected by the end of the year, then it may be longer lasting immunity. So if there's areas with high seroprevalence, well, then they may not need the virus or the vaccine as much as areas where there's a lot of susceptible hosts, because you don't have as many antibodies circulating.
Last question on vaccine. Should immigration status play any role in whether or not a person gets a vaccine?
No.
Okay. With regard to elections, do you have any problems with vote by mail in the state of Florida?
Well, see, I think that this is important, because I think there's a confusion. In Florida, If you want to vote by mail, you request, you call the supervisor, you send an email, you submit a form, and then they send it to you. I think the places where we've seen real problems, where it's just indiscriminate mail ballots being sent everywhere, flooding regardless of whether you've asked for it or not. We do not have that in Florida. I do not support going to that model in Florida. I do think the model we have, where you can request, you don't have to be sick or out, you just, no excuse absentee. I think that that's been successful, and I think that it's had integrity.
You think that you should be encouraging it because, let's face it, it may be hard. A lot of times poll workers are older Americans, who are at risk. We've seen problems in some local elections in South Florida where, with the virus, you may have trouble getting people into polling locations and staffing enough polling locations. Should you be encouraging, will you be encouraging people to actually take advantage of vote by mail?
Well, they should do that, but we also know there's a lot of voters who want to vote in person. I mean, that's just the reality. So we have made preparations to augment any of the poll workers and the staffing should there be shortfalls. Now, we did do the primary in the third week of March, and that was kind of right when it got really heavy here. And we didn't have very many problems except for a couple counties. So my view would be, we kind of went through that. We're going to go through a primary here in a couple weeks, figure out where there's some shortfalls, and then be ready to do. But I mean, I've told the Secretary of State, and we need to have a lot of people ready on the ground. So yes, request your ballot. You'll get it. It's safe, and every Floridian should know that. But if you do want to vote in person, we're going to make sure the polls are open.
You spoke to the president the night before, according to your schedule. You spoke to the president the night before he made the decision about pulling out of Jacksonville for the RNC. Did you two discuss it? Did you recommend or suggest that this could become problematic to hold an event of that size in Jacksonville?
No, I mean, I think it was more about kind of some of the internal dynamics of the convention committee and stuff like that that he was concerned about. I think Jacksonville's trended down on this. I think we'll be at a better spot throughout August. Obviously, we got to respond, but it wasn't anything. I said, look, whatever we're going to do, but I just understand what they were planning. This was not just going to be a willy-nilly thing. I mean, there was going to be testing, there's going to be masks, there's going to be all these different things that were going to be done, and they understood that we obviously want to have a safe environment.
When you say problems with organization, there's this perception that you dislike, or maybe that's the wrong word to phrase it, that you have issues with the person who the Trump campaign has picked to run the state of Florida, Susie Wiles. How would you describe your relationship to Susie Wiles, and do you think she's the best person for Donald Trump to use in running the state of Florida?
I don't have any relationship, but what I told the president, you put whoever you want in charge. Do not worry about, I'm going to be working hard, we're going to be doing what we've got to do, so put who you want to be in charge, and we'll be there.
But you're not a fan.
Look, politics is politics. I mean, at the end of the day, my responsibility is just to work as hard as I can. I think we've got a lot of great people in the governor's office who have worked hard. I mean, people have not really had very many weekends since February, in the executive office of the governor. I mean, maybe a couple. It's been pretty much 7 days a week for them, and they've worked really hard, and I think they have a lot of public spiritedness. And so, I'm appreciative of that.
I'm not going to ask you if you're thinking of running for president because you're too smart a politician to answer that question directly. Instead,
I'm also not, though. I mean, at the end of the day, any speculation that gets thrown out there, all I've done is done my job. I mean, I don't have a political operation or anything like that. I come, I go to work, I do it. If you look, since the time I got into office, I've done very little political events. I mean, I've done a few, but it's like, I've always put the substance of the job first, and the constant political chatter, I just tune all that out, do my job, and we're going to continue to do that going forward. So any type of speculation, that is people on the outside imposing that on me. I can tell you, I'm not fueling any of that.
Let me just ask it this way, though. Would you like to be president?
Not right now. I mean, it seems tough. The governor, this has been a very challenging run. I think.
In general, would you? Is that something that you've ever thought about? I'd like to sit behind the Resolute desk.
It's not something that I wake up thinking about, no. I mean, I got to take it a day at a time here. This has been a real challenging thing, in a pandemic. We had the storm that came a hurricane. Yeah, fortunately we did well on it. But, it had always been hurricanes, and they are very important. But a hurricane, it develops, it comes, and it goes. And it's a finite amount of time. Sometimes, unfortunately, the reconstruction can take a lot. the pandemic has just been day after day of emergency operations, and it's been a real challenge, and I think people have worked very hard, but we've got a lot on our plate, and that's what I'm focused on.
Do you think Rick Scott would make a better president than you?
You guys, I know you're looking for a good soundbite here or whatever, but I got a lot of respect for a lot of folks in the state of Florida. I work with Rick. I work very closely with Marco, and obviously, the president's now a Florida resident, so we've got a lot of people that care about the state of Florida.
Last thing, and I don't mean to put it just at the end, but and this is truly the last thing, is just in going through my notes. You've given a fair amount of support and been given credit for giving a great deal of support for historically black colleges. I think about $20 million that you did not cut from the budget. That's a part of the story that is not often told with regard to you. But I do want to ask you about Black Lives Matter. How do you view that group? How do you view the folks who are calling for change? And do you believe there is systemic racism in law enforcement?
So I am not on board with defunding the police or attacking law enforcement.
Well, nobody's talking about defunding the police, really.
Oh, yeah, they are. Yeah, they are. You look at some of this stuff, I mean, it's really nasty. And so I think that obviously, we want to be supportive of everyone. I want every Floridian to succeed. When there's injustices, we need to recognize that. We sent Mary Bethune's statute up there. It's going to be in Statuary Hall. Well, we authorized it. It's going to go up. But the HBCUs, so when I was a congressman, I had Bethune-Cookman in my district. So I was a member of the HBCU caucus in the House of Representatives, and we worked with that. I was working in the White House when President Trump did his big HBCU initiative. But one of the things that I really appreciate is just how important a part of the history of Florida. I mean, you look at like a Florida Memorial, Edwin Waters, they were founded during Reconstruction. You had 13th, 14th, 15th Amendment, but man, there's a lot of people in the state of Florida that did not want African Americans to get an education. So they would literally be shot at in the classrooms. They'd have to move the schools around different places. Obviously, Mary Bethune with what she did at the beginning of the 20th century. So it's really a story, I think, of perseverance and really battling against the odds that I think is an important part for people to know in history.
But I do want to bring you back to Black Lives Matter and the protests, and not about defund the police, but about the issue when you've already spoken that you disagree with vehemently. You were on it discussing what the video that you saw of George Floyd and how he was dead. Can you understand why some of these folks are taking to the street, wanting change and saying Black lives do matter?
Well, I think anyone that sees that video, is going to be horrified. And obviously, if you're an African American and you view law enforcement, as being more focused on you, that's going to be even more so. So I absolutely get that. But I also think we cannot paint with a broad brush. I mean, look, in the state of Florida, we have almost 25% of our law enforcement personnel are African American. We have officers of all race, colors, and creed. If they get a call, guess what? For a victim, they're getting there, and it doesn't matter if the victim's white, black, Latino, it doesn't matter. And that is the story of the men and women in law enforcement.
So you don't believe there's systemic racism in law enforcement?
I do not think law enforcement is racist. I think in every organization, you are going to have people, and not always because of race. Sometimes people just abuse power. When I was in the Navy, we had some bad apples. It was a great organization that dealt with those folks. And I think in Florida, that's pretty much how our law enforcement leadership has been. Train, equip, but if someone goes astray, we'll hold them accountable. But we should not condemn the entire organization. And I'll tell you, when you see these police officers attacked for going out, and you see what's happened in some of these cities, I think it's been a tragedy. And I don't blame every protester, because many of them obviously don't support that. But just the view that it's so negative, I think is really unacceptable. When you have the police pull back, the people that are the most affected by that are the most vulnerable in our society. The strong people are going to be able to be fine. If you have a gated community, you're going to be fine. But it's those vulnerable folks that need the rule of law. That is why it's so important that we do it. So people in Florida, the law enforcement community should know, I stand behind them 100%, and I also support when they need to take action to discipline some of their own. That needs to be done occasionally.
Looking back over the whole, since the pandemic began, what do you wish you had done differently?
Well, I think early on, when we had some of the things we closed elective surgeries, we closed gyms, those were recommended to me from on high. But thinking those through, I mean, you know, the hospitals, they got killed in March and April. They were never overwhelmed. You know, I wish I would have, you know, kind of thought that through a little bit better. And in this time, as we started to see more admissions, I told all the CEOs, you guys make the decisions about how you're going to manage it. I'm not going to issue an edict because some were very busy, like Jackson. There were others who had more COVID, but were still fine to continue. And then with the gyms, you know, we have a disease in which if you're under 50 and you're in good shape, you know, your risk is very low. But then we were telling people effectively don't go work out, which I think was a bad message. And so, you know, those are some of the things where I wish I would have thought a little bit more critically about it. We ended up finding most of the hospitals were like, look, Governor, we understand what you did. They're not upset about it, but it was not an effective policy.
How confident are you President Trump is going to win the state of Florida?
I think he'll win.
Okay. Anything else you want to cover? No. We covered a lot.
All right.
Yeah. Thank you very much. Good.